All right, everyone. I think we're going to go ahead and get started. Looks like everybody's just about registered. Good morning. My name is Micah Matthews. I'm one of the marketing directors here at Messer Financial Group. I would like to start off by thanking everyone for joining us on this beautiful Wednesday morning. I know everybody's got a million and one things to do, so I appreciate you taking an hour out of your day to spend it with us. Opportunities like what we're going to discuss today just show how great it is to be independent agents. Anybody that has ever worked for a captive agency or carrier or product understands the valuability of being able to pivot wherever opportunity is. You know, there's been a very limited amount of options on the under 65 health side in both North and South Carolina in the last few years. So to have new opportunities, especially ones like that like I said, we're going to go over this morning, it's a special time for us. So for those that maybe have lost out on the opportunities in the ACA or haven't been able to focus on it or whatever the case may be in the last few years because of the limited opportunities, we're going to go over some new opportunities which could bring some real life back into the market. We are greatly privileged to have Ambetter with us today. Michael McCarran will be the one that's going over everything. He is the sales rep for Ambetter. Last year, for those of you that don't know, was their first year in North and South Carolina. They came in kind of as a feeler, and this year they're looking much better position as far as rate-wise, benefit-wise, and commission-wise. Now, one thing that we will not go over on this webinar is commission rates. We will do that offline individually, so you're more than welcome to contact us to find out what those are, or also if you're working with an upline, you can contact them directly. Everybody is in listen-only mode. We will take questions, so you should see an area where you can type any question that you have as we go. We will answer all questions at the very end. But before I turn it over to Mike, I want to show you just a few things. This is our website that you see on your screen right now. This is messerfinancial.com. If you go under here, we have basically everything that you'll need to be able to write business. Under agent resources, just about everything that you would need. If you need E&O, we have that for you. But what I'd like to show you is under quote tools. There's a different quoting tool for just about every product, the life quoting tool, Medicare, whatever you need. But for this purpose, we'll focus on the health quote. You can just run a quick quote here. It's real simple for those of you that have not used this before. For those of you that are, we are still going to have that for one more year as well. But also we have our MyMFG quoting tool that is something that Messer Financial built for you guys. Now, we spend a lot of money on this, and we are offering this free to charge for anybody that wants to partner with us. This does not only do ACA quote and enroll, but it will also do Medicare Advantage. So for those of you that are doing multiple products, this is the product that you're going to need. Plus, it will show you some of your demographics as far as what you've produced and anything that you've enrolled through here. So it works as a CRM as well as a quote and enroll tool, plus a lead distributor. So I highly recommend if you are a partner with us and you haven't been activated on this site yet, please let us know. We will get you set up. Or if you've had any problems with it, let us know on that too. It's as simple as me walking right down the hall and talking to the IT guys to fix it. So, and like I said, it will do both MAPD and ACA. You can quote, you can enroll, and again, it keeps all of your track of all your business. So two different quoting tools. The one on our website here is just for quoting. This one here is for quote and enroll. So just to let you guys know some of the options that are available to you. Also, I want to make sure that everyone knows about our Top Producer Summit. Every year we do a big event where we get together with our top producers around the country. We fly them in. We put them up in a nice place in Concord, North Carolina at the Embassy Suites. We have all the carriers there. We do a whole day of activities. It's a lot of fun, and the only thing that you need to do to qualify for that is you have to have 200 members on the books. Now, for those of you that have been on a carrier vacation or some kind of reward trip, then you know it's based off of that year's production. Well, that's what separates us, is that with our trips, once you hit that 200 apps or members, then you're already qualified for next year, as long as it doesn't go below that number. So whether you write a single app or not, as long as your number does not drop below 200, you will continue to qualify for these trips every single year. Also wanted to let you know about our chairman's trip. We do a big blowout event for our top agents, and that's To qualify for that as an individual, you have to have 500 members on the books, and you also have to have all of your appointments through Messer Financial. Plus, again, once you have that 500, as long as your number does not drop below that, you will qualify on these huge trips. This past year, we went to Kiowa Island. So for those of you that are joining us from South Carolina, know how great of an area that is, and it's basically a once in a lifetime opportunity. So we're going to do a different place and a different theme each year. But again, it's 500 members to qualify for this for each individual agent. And if you are an agent C, then it's 1,500. So these are all things that you can qualify for. We want to reward those for partnering with us. We want to support you and do whatever we can to make you successful. So just wanted to point out a few things before we actually get started. So with that, again, hold all your questions. We will go over those at the very end. Some of the things that we are going to go over is who is Ambetter, where they're going to be in North Carolina and South Carolina, what their product is going to look like, what their network is going to look like, added benefits such as the member portal, things like that for your clients, how to look up a provider, and also the broker portal. So those are the few topics that we're going to go over. So with that, Michael, I'm going to turn this over to you, and it's all yours. And Bobby, if you can switch the screen, I'd appreciate that. Thank you.
Thanks, Micah. How's everybody doing this morning? Really appreciate the opportunity to kind of share our info with you guys. 1 second here, get the presentation up and running for you. Really excited to be able to kind of speak with you guys. You know, I've been working pretty closely with Mike and some of the guys over at Messer leading up to OEP. So really appreciate the partnership that we've been able to build together to kind of prepare here for the 2020 OEP season. So without further ado, kind of going to jump right in here. Today we're going to, you know, like Micah had mentioned, I'm going to give you a little info about who we are as Ambetter. I know, you know, kind of dipped our toes in the water a little bit in the Carolinas last year. You know, so we'll just kind of want to give you guys a little bit of information about who we are, you know, our network, our footprint this year for the 2 states, and some other benefits that we have for your members, our products. So we'll kind of go through a ton of info today. I'm going to try to run through it. And like Micah said, if you have any questions or anything like that, we'll definitely get to those at the end. So without further ado, let's get going here. So first and foremost, Ambetter. Kind of want to tell you who the heck we are. You know, like I said, we just started kind of selling in the Carolinas last year. So a little bit about us. We are underneath the Centene blanket. Centene is our parent company. You've probably heard of them in the Medicare Advantage market, Medicaid, if you do some of the other lines of business. Centene is a Fortune 100 company, and we've spent over 30 years working in the managed care market out there. So Ambetter is the ACA wing of Centene. So this is all that we do. We're the #1 issuer in the marketplace. So even though we're new to the Carolinas, across our footprint, we have about 2 million members, which is actually going to be the largest out there for all the different carriers across all the different states. And here's just a map of our footprint. Today, you know, we're obviously going to talk about North and South Carolina, but we are in other states. I know if some of you guys are already contracted with us, you may have your foot in some of these different states. That's something that, you know, Mike and Justin and I and some of the guys over at Messer have been working to get a lot of you guys contracted for some of these different states. So as you can see, pretty heavy presence in the Southeast, in the Midwest, and then we also head westward with Texas, Nevada, Arizona, and Washington to kind of round out our footprint. And for North Carolina, you know, if you sold with us last year or kind of saw us out there, you see we had a bit of a smaller footprint last year. We were only in Durham and Wake County. So this is our footprint from 2019. You know, with the success we saw last year and some of the market share we were able to garner, we really wanted to make North Carolina a part of our future here at Ambetter. So we grew our footprint. We added 12 new counties this year. So if you see here, you know, like I said, we were just in Durham and Wake last year. We've really branched out, getting as far as Greensboro, and then some of those counties that are going to surround the Raleigh-Durham area, and some rural counties as we get outside of the cities as well. You know, and as you see, you know, we added 12 new counties for 2020. All expectations for the future of 2021, 2022 is to continue to grow this footprint to Charlotte, all over Winston-Salem, to cover the whole state, ideally within the next few years. And then for South Carolina, again, you know, just kind of got our toes in the water a little bit last year. We were just in Charleston County. We've had substantial growth in our footprint for this year. So as you can see here, kind of filling in the raspberry, and that's our color here at Ambetter. We've really tried to trademark the raspberry. We're a little bit different than some of the other carriers. We try to pop out with that, but our footprint here, there's the multiple counties outside of Charleston. So you see like Berkeley, Colleton, some of those other ones outside of Charleston we've added this year. And then two kind of rating areas that we've gone into is that Rock Hill area. So York County, and then some of those counties around there, Lancaster, and then also Myrtle Beach, Horry County, and then Marion and Florence as you head westward. So that's going to be our footprint for this year, and where you'll be able to offer Ambetter to your clients. And we hope to be a large player in these markets and a great alternative to some of the other folks, mostly Blue Cross for most of you guys throughout the last few years. Next, want to just dive into some of our featured plans that we are going to offer this year across all markets. And these are going to be both North Carolina and South Carolina. So this information is going to cover both states. We have a similar product portfolio, and a lot of the information is going to cover both states, equally. So just a little refresher. I know some of you guys, like Micah had said, maybe have gotten out of the ACA market for the last few years just with not having some different options to offer. We focus in on the three main tiers. There's four on the marketplace. We do not offer a platinum plan, kind of that top tier. So what we offer is bronze plans. So those are going to be those lowest monthly premiums with the higher deductibles, so some of those utilization costs are higher. We have the gold plans where you pay a higher monthly premium, and then you have lower out-of-pocket expenses on the back end with the deductible, things like that. And then the silver plans, this is really where we focus. This is our bread and butter. Like I said, all we do is the ACA, but we really, even further than that, we really focus in on the silver market, and that's where we try to gain most of our market share. So for us, we look at this as kind of the best of both worlds. You have the medium kind of tiered as far as pricing with the premium and out-of-pocket expenses. But then also for us, a lot of our membership are folks that get the advanced premium tax credits. So they're available on all plan tiers, but then we have those cost-sharing reductions that allow a lot of those utilization costs to be covered for members. So we really design a lot of our plans to maximize that. So on your side as a broker, your members have a lot of lower out-of-pocket costs. So here's just kind of a 30,000-foot view of our portfolio for this year. Like I said, we really focus in on the silver tier. So we have a multitude of different products, 5 in the silver, and then just that 1 in the gold, and then 2 in the bronze. Really with the bronze, we have just a regular bronze plan, and then we also have a HSA plan as well. But we'll kind of dive into a few of the different products here today. First one I wanted to call out is our bronze health savings account. And what we call here, at Ambetter, we refer to our bronze plans as essential care. So if you see an essential care with a number, those are going to be our bronze plans come OEP season. Just some big numbers kind of want to call out here are the deductible and the max out of pocket. On our bronze plan, these are going to match. So it's going to be $6,750 for the deductible and the max out of pocket. For your members, that's going to be kind of the total windfall, worst case scenario number for those guys. And then moving forward, like I said, this is really where we focus in. So this is going to be the silver. We refer to these plans as our balanced care. So if you see a balanced care, internally we like to call them BC. So like this is going to be balanced care 11. For us, this was new last year. It was a huge market driver for us. In most markets, it was the lowest cost silver. This year, you'll probably see that in a lot of those rating areas and footprint that I just mentioned in North and South Carolina, especially South Carolina, our price position looks pretty incredible, where we should be the lowest cost silver in just about every county that we're in. Just kind of a refresher, there's going to be 4 main kind of levels within this plan. So there's the base silver. Those are folks that do not qualify for the cost share reductions. The 73%, so they are getting those CSRs, but a little bit smaller than some other folks. The 87% and the 94%, probably, you know, when you look at a plan like a Balanced Care 11, a lot of the greatest savings are going to be at the 87 and the 94 level. So first, looking at the deductible for these. So if you're in that 87 or 94% CSR level, you're actually going to have a $0 deductible. So, you know, after your premium, pretty much the first look here, you know, $0 out of pocket for that deductible. As we move a little bit, you know, lower on the CSR levels, the 73%, $3,250. And then that base silver without the deductible, without the CSRs, you're going to have a $6,000 deductible. As we get to the max out of pocket, again, kind of focusing in on that 94 and 87%, you're going to have a $1,050 at the 94%. So you think premium and max out of pocket, worst case scenario, that's what your member is going to be looking at if they fall into that 94% CSR level. The 87% is going to be $2,700. And then 73%, $6,500, and then that base silver max out of pocket is $8,100. Again, kind of a theme here. You see the higher the CSR, usually the lower the out-of-pocket expenses here. We're going to go through the PCP visit. So just going to see your doctor. For 94%, that's going to be no charge, so no out-of-pocket costs for those folks. 87% is $8, $20 for the 73%, and then the base silver is going to have a $30 copay for your PCP visit. Specialist visit, the 94%, $5, $15 at the 87% level, 73%, $50, and then the base silver is going to have the $60 specialist visit. As we get kind of into the prescription, so 2 different, you know, variations here. We have the generics and then the preferred brand drugs. Again, 94% no charge, no out of pocket for your generic drugs, 25 for your preferred, 8 and 30 at the 87, 20 and 50 at the base silver, and then also at the 73% CSR level. And then I like to consider the Balanced Care 12 our sister product. So last year, you know, the BC 11 in most markets was the lowest cost silver. The Balanced Care 12 is actually going to be our lowest cost silver. So again, some of these markets, it'll probably be the cheapest silver that you see on the premium side. Again, you know, the 4 different levels, really some of the trade-offs here between the BC 11 and BC 12. There's about a 1.5 to 2% difference in the premium. So saving a little bit on your premium side, but then there are going to be some different adjusted costs on the back end for the utilization. So I think, you know, if I'm a broker and I'm looking at, you know, talking with my member at the time of enrollment, do you want to have a lower, you know, premium up front and then maybe a little bit higher on the utilization cost, or you know, am I somebody that tends to use my insurance pretty heavily? Do I want to keep those out-of-pocket costs on the back end a lot lower and maybe pay, you know, a handful of dollars more each month? So the deductible here, 94%, $0, just like on the BC 11. The one main kind of difference here is you can see at the 87%, it's $0 on the Balanced Care 11. It goes up to $950 on the BC 12. So again, lower premium, just a little bit higher on some of these out-of-pocket costs, and then the base silver and 73% round out at $6,500 and then $3,850. Again, you'll see a little bit of slight difference here at the max out-of-pocket. The base silver and the 73% stay the same, $8,150 and then $6,500. But then as you get a little bit higher up on the CSR level, $1,400 versus that $1,050 on the Balanced Care 11 for the 94%. And then $1,850 for the 87. That also has a slight kind of raise there. But again, lower premium for this one, and just a little bit higher on some of those utilization costs. PCP and specialist visits. So again, no charge for the 94%, $10 for the specialist visit. 87% is $10 and $30, 25 and $60 for the 73%, and then 35 and $70 for the base silver. Again, just kind of going through the prescription drugs. Generics, no charge for the 94%, $30 for the preferred brand, $10 for the 87, $35 for the preferred, 25 and 60, and then 25 and 60 for the base and the 73%. So again, as you can see, just kind of some of these differences, maybe $5, $10 extra dollars on the back end for maybe some of these prescriptions, PCP visits, stuff like that, for that lower premium throughout the year. So again, just kind of up to the member what they're necessarily looking for. Both of these should be very low cost, though, comparatively to the other carriers out there. So another balanced care, this is going to be a silver plan as well. This has an interesting design. It is a silver plan, so you get those cost share reductions, but it's built a lot like a gold plan. So this is going to be our highest premium as far as the silver. But then you see like the deductibles here for the base silver and the 73%. This is who we kind of designed this plan for. $29.50, and then 73% for is going to have $28.75. So this is great if you're somebody that wants to have some of these. You get tax credits, stuff like that, but you don't necessarily qualify for a cost share reduction. This is a great plan that's going to have some lower out-of-pocket costs for the folks that necessarily don't qualify for those higher CSR levels. Again, just max out-of-pocket. The base silver, $81.50, 73% is going to be $6,500, 87%, $2,400, and then $13.50 for the 94% CSR level. Start going into PCP visits. No charge at the 94, $15 at the 87, $30 at the 73% CSR, and then the base silver is also $30. Specialist, $10, $30, and then $65 for the base and the 73%. Generics and brand drugs, again, prescription copays, no charge, and then $25, $10 and $30, $15 and $60, and then also $15 and $60 for the base and the 73%. So our Secure Care 5, this is our actual gold plan. So like I said, the Balanced Care 15 is a silver plan, but it's designed a lot like a gold plan. There's a lot of similarities here. These are folks that do not qualify for a CSR, but want to pay, a higher out-of-pocket for the premium, but then there's some of their utilization costs in the back end are a lot lower. First, the deductible. So you see, a lot lower on this, the $1,250 versus some of those silver plans, especially, if you're somebody that's not getting a cost share reduction. The max out of pocket is $5,900. So again, versus maybe that $81.50 for the base silver. These folks may, want to go with something like this where they pay a higher out of pocket premium, but then they have that the lower costs here with the max out of pocket. PCP visits and specialist visits, $15.35. And then the prescription drugs, generics, $15, and then $30 for the brand preferred drugs. And then pediatric vision, just wanted to cover that. One thing I would really stress with this is just make sure, use our Find a Provider, which I'll show you guys how to use, and go to an in-network provider for this. It's going to be no cost. So $0 for exams and eyewear, like copay on that. Eye exams, 100% covered. Same with, if somebody needs glasses, things like that, contact lenses for pediatric side, it's going to be 100% covered as long as it's an in-network provider. We also offer an adult vision and dental buy-up. These are not standalone plans, so they would just be a buy-up onto any of our plans. So whether it's Balanced Care 11, Essential Care 2, this is going to be a buy-up. So this is the adult vision and dental. Some of the things just wanted to call out on the vision. $0 copay for your eye exam, and then eyeglasses, and the same with contact lenses are going to be covered up to $130. The adult dental, one kind of main point here, we cover up to $1,000 per person per calendar year, and a little bit different than on the actual health side of it. It's not you reach 1,000 and then Ambetter covers the rest. This is going to be we cover up to $1,000 for the year. Some of those routine things, the oral exam, cleanings, x-rays, stuff like that, $0 copay, subject to the annual maximum. And then as we get to some of the more of that basic stuff, fillings, things along those lines, 50% co-insurance up to that $1,000. And then the major stuff, crowns, bridges, dentures, anything along those lines, we're going to cover 50% coinsurance up to the annual maximum as well. So kind of what happens after the application. Some of you guys are obviously going to be familiar with this. If you've been out of ACA for a couple years, you may not be as familiar with how the process works. Basically, after you guys complete the enrollment, the marketplace sends us an 834 file with the actual enrollment. Usually takes about 24 to 48 hours for us to receive that from the marketplace. I think we've all had those horror stories with the marketplace. We've been doing this for a few years, but for the most part, 24 to 48 hours on that. After we receive that file, it's going to take us about 7 days, 7 business days. We're going to shoot out a welcome letter and a billing statement to your member. I'm going to detail a few things on that as well. And then after the first payment, so once the member makes that first payment, they're going to receive their ID cards. Again, usually get that about 7 to 10 business days from the time of that first payment. So what comes in that welcome packet that we send out? 3 main things. The welcome brochure. It's going to have information about our My Health Pays program, really great member benefit that we offer that we're going to get into as well. A premium rate letter, and then the plan brochure. So just kind of showing you what your premium is going to be throughout the year, and then a little bit more information on your plan. Next, we have a start guide card. So for the member, I just signed up for this Ambetter. What the heck do I do next? Here, we're going to kind of give them a checklist of things to go through to make sure they're ready to go to have their policy effective and ready to use on 1/1. The tip sheet, just information about the member's rights, responsibilities, that evidence of benefits, all that stuff is going to come in here as well. One thing just want to call out, probably everybody on the call is definitely familiar, but just a refresher, a policy is not going to be effective until that first month's premium is received. So if you do the enrollment, right at the beginning of open enrollment, they still need to make that payment before the policy is effective for 1/1. A couple ways to make a payment. The easiest one I think is paying online. Even at the time of enrollment, you can get routed to our payment portal to set up auto draft and make that binder payment at the time of the first enrollment. Members can pay by phone. They can also pay by mail, and then we can also pay by MoneyGram as well. So 4 different ways to make that payment. Some added benefits on our plan. So these are things that members can utilize. The first being our My Health Pays program we're going to get into. Personally, I think it's a huge benefit that we offer. Great way for members to earn money towards some of their medical out-of-pocket expenses, co-pays, premiums, things like that. The Ambetter telehealth, and then our health management programs. Our telehealth is, for folks that, maybe don't have time to go to the doctor. They can call this number and have a consultation with a licensed physician. So My Health Pays, this is a great benefit that we offer. Real easy for folks to earn points that they convert into dollars. As easy as getting your flu shot, making your annual PCP visit. We're going to give you points that can be, again, converted into dollars to use for your premiums, co-payments, deductibles, anything along those lines. We're going to give you money back for just living a healthy lifestyle. Next benefit kind of wanted to go over is the Ambetter telehealth. Oh, and I'd be remiss to mention the My Health Pays. You can earn up to $500 in rewards and actual dollars throughout the year. The Ambetter telehealth, like I said, 24-hour help for non-emergency issues. So, if you have a broken leg, we still want you to make sure you go to an ER or urgent care. We're not saying, use this and only use this. The real big benefit here is it's a $0 copay for members. The only ones the little caveat to that are folks that are on the HSA plan. It would still be subject to their PCP copay. But for the most part, everybody, this is going to be a $0 copay for this consultation. So, hey, I'm at work, I got the sniffles, I'm not sure, if I need a prescription or something. I can give this, telehealth a call, or it's like a Skype version with them, and they'll be able to prescribe you medication or let you know, like, hey, this is a little more serious. You may need to go see a specialist or go to the hospital, something along those lines. But great way to avoid long wait times at the physician's office and urgent care. Also saves you on the dollar amount side without having that out-of-pocket expense for the copay. Easy way to register. And one thing I want to call out here is Teladoc is our vendor. So if you think about normal doctor's offices and stuff like that, people being in network and out of network, the telehealth, Teladoc is our vendor. So in order to get that $0 copay and for these guys to send us the bill for the consultation, it has to be Teladoc. Two ways, so you can go online or you can call 1-800-TELEDOC. And your members are going to get this stuff, so don't worry about necessarily writing all this down. We'll have plenty of information, plan grids, everything like that available on our website prior to OEP. I know I'm kind of running through this real quick, but last little point here, when they call, just make sure they have their ID card with them. They just need to give the agent their first and last name and date of birth, and they'll take care of them right away. Lastly, we have some health management programs. These are for more of those like chronic different illnesses, things like that, asthma, depression, diabetes, coronary artery disease, high cholesterol, high blood pressure. Hopefully none of us get that during OEP this year. And then, if you're looking to quit tobacco usage, we have some programs through our member services can help folks manage some of these illnesses and hopefully, live a healthier lifestyle. Real quick, just want to dive into the member portal. So this is for the members. After they enroll, they can get logged in here. That My Health Pays link is going to be in here to their portal, so it'll keep track of all their points and their dollar amounts that they've earned throughout the year. They can pay their premium in here. They can set up their EFT in here as well, so if they want to do auto draft monthly. A link to the Finder Provider, which we'll kind of go through here a little bit later on, just how to use that. And then they can print out temporary ID cards as well. So if I get a doctor's appointment and I lose my ID card, I can go in here and print out a temporary one. And then also we're just going to show that member's coverage at a glance. So just some of the bigger numbers, the max out of pocket, the deductible, and then what their PCP copayment is going to be. We'll have that all listed. So getting into some of the broker reports, things that kind of matter to you guys, where you can keep track of your membership and everything with Ambetter. The first being the broker portal. So once you get contracted with us and the contract's been officially approved, we'll create a link for you, with a username and password to get into your portal. And then we also have a great team, our broker services team. Their numbers up there. They're great for like our tech support. If you have issues with your portal, our enrollment platform, some of those things, they can help you out. So that's their number, that 855-700-7985. Again, so at the broker portal, you put in your username, password, gets you logged in. You're going to see a screen like this. There's going to be three main kind of windows we're going to talk about. The first being your total active members. So we're going to show you how many members you have active with us. Next is going to be a delinquency report. So we break folks down into the 30 days, delinquent, 60, and 90. We'll kind of get into that as well. And then lastly, the unpaid binder payments. So these are folks that haven't made that binder payment just yet. A little bit of a deeper dive into each. The total active members, so if you click on that, you can see all the different policies that you have, how many members are associated with that policy, everything along those lines, and the effective date. When you're in the broker portal, the policy number is going to be highlighted. There's going to be a hyperlink. You can click on that. It takes you into the policy details. So a few things here, you can see what your member is going to have to owe for their premium. Kind of the one for them, especially folks that are getting those CSRs and the APTC. The net premium is the member responsibility. We do show what the full premium would be and then what their tax credit looks like in there as well. You can get kind of deep dive into the policy of the member's family, so it'll show, husband, wife, children. And then also something that's missing from the screenshot that we just added, next to that view button that's kind of in the middle of the screen, there's a button in the policy details that says order ID cards. You can click on that as a broker. So if I call you as a member and I said, hey, broker, I lost my ID card. How do I get a new one? You can just hop into your broker portal, click on their policy, click that button. It will send a message to our member services. And then usually within about 24 to 48 hours, they get that in the mail to your member right away. Also can keep track of payments, things like that for your members in their policy detail. Next, the delinquency report. Again, we have this nice little pie chart here. You can click on the different colors. It'll break down the 30, 60, and 90, and then whichever pie chart you click on, it will bring up the policies that fall into that category for the delinquency. Hopefully, we don't have as many members as this example for 337, but a great useful tip to kind of keep up with who's making their payments and maybe who has fallen behind a little bit. And then lastly, the unpaid binder payment list. So this is just going to be folks that you've enrolled during OEP that haven't made that first payment to lock in their policy. Again, those are not going to be effective until we receive that first payment. We're going to show you the list of all the policies that fall into that category. Again, you can click on the policy number and see what the premium is going to be there to kind of go through everything. Again, this is just another window here. Up at the top, there's the home, policies, commissions, and resources. If you click on policies, it's going to list everything that you have. You can search through here by policy number, last name, pull up anybody you're looking for. Also, a great little helpful tip. I know folks sometimes like to pull, their lists out into like an Excel sheet. You can export all of your policies into an Excel to keep track as you're making calls and things like that, especially, maybe for the 2021 OEP when you're going through renewals. This is a great way to kind of check off everybody. But again, just a couple different column names here. We have like the names on the policy, paid through date, their premium, delinquent status, the active members on the policy. I know Michael was showing you guys have an enrollment and quoting tool at Messer. We partnered with Health Sherpa for the new enhanced direct enrollment. So we're going to have an Ambetter portal. Basically, you can do quoting and enrollments through here. So this is just kind of a screenshot of what your client list is going to look like. So anybody that you've enrolled will show up here. You can kind of keep track. The marketplace will send information to Sherpa, and then to you, if somebody needs to upload tax documentation or if there's something missing from the policy, they can get that info. They'll let you know what's missing here. If you've used Sherpa in the past and you want to kind of maybe import your members list, if you have Ambetter clients, or you're looking to maybe move somebody from a Blue Cross to an Ambetter, some of the other carriers out there, you can export your list from your personal Health Sherpa and then import it into here. Or maybe you've never used Health Sherpa before, but you have your members application ID. Up in the right-hand corner there's a search marketplace button. If you go and click on that, you can just search the application ID on the marketplace, and then Sherpa will be able to pull all that information for you to do a renewal or go through and create an application for these folks. Real quick, this is a screenshot of putting in that demographic information. It'll show you kind of your eligibility for your cost share reductions, your APTC, stuff like that. And then this is just going to be kind of after you've gone through the demographics, the quoting tool. So it'll show the premium, the deductible, and then it'll take into consideration if somebody's getting a tax credit, it'll show what their out-of-pocket costs are going to be. And for our portal, it's only going to show Ambetter rates. So it won't have anybody else that may fall into some of the other carriers might fall into your area. These are only going to be for Ambetter, the Ambetter rates. Next, just kind of want to dive into our website a little bit. So find a provider and then our medication list. Our find a provider. So if you go to our website, you click on find a doctor. From there, it'll take you, have you take you to your state's website. You click find a doctor. And then it'll bring up this little box. I always recommend using a zip code. We go based off proximity of the search area for our information. So the zip code usually helps make that a little bit truer to where you're actually at versus maybe typing in Raleigh or Charleston. I like going through and just putting the zip code in for the member. Then you just choose what network you're in. So from there, you select your state. Here we're using Illinois. You guys would obviously use North Carolina and South Carolina. One big key point here, I would use the detailed search. For example, we have the quick name search there, but if you search Dr. John Smith, but maybe when Dr. John Smith contracted with us, he gave us the name of his practice. So if you search John Smith, he may be in the network, but he might not pop up that way. But his practice it might be Smith Family Practice. That might be a better way to find it. So I always do the detailed search. You can go through, pick whatever type of provider you're looking for, whether it's a hospital, PCP, specialist of any sort. You go through, do the type of provider. I'm going to bring you up a long list of names based off of proximity, again, to wherever you put in for your location. We're going to list out all the doctors, hospitals, things like that in your area. Just some things I wanted to highlight. I got a slide on North Carolina, and I'll give you the South Carolina partnerships as well. The big partnerships we have in North Carolina are Duke and Wake Med. So again, that Raleigh-Durham area, we have a very strong network. I think, comparatively to some of the other carriers where maybe they've pulled out of agreements with those two, we still have those as an option to your member. And especially, in some of those rating areas, we're going to be the lowest cost silver. So not only are they maybe going to save some money, but they're also going to get a very strong network. And for these networks that we have listed here, it's going to be facilities, doctors, specialists. Those are all going to be in network with us. And again, there are going to be maybe a doctor or so that may have opted out and chose not to contract with us from those networks. Just refer back to the finder provider. But for the most part, I'd say about 99.9%. If they're affiliated with any of these networks, they're going to be a part of the network. The other two are Cone Health and Duke Life. As you get towards that Greensboro area and kind of that gap between the Raleigh-Durham and Greensboro area. In South Carolina, I don't have it up on my screen, but I wanted to give you some names of partners. These are going to be kind of the same deal here where, we have a larger network that has facilities, doctors, specialists, anything kind of under the sun is going to be a part of the network. MUSC, so all those locations across the state, in our footprint. Tenet Health. I think a big one for our rating areas up in that Rock Hill area. Piedmont is one of those facilities. But again, facilities, doctors, everything along those lines. Trident Health, and then HCA. I think Trident is more kind of that Charleston area. But then, all of these MUSC, Tenet, Trident, and HCA, multiple facilities, multiple doctors, specialists, that's all going to be a part of our network throughout our footprint. Kind of last but not least here, finding a medication. So, at the time of enrollment, you want to see, hey, I would maybe take a cholesterol pill chronically all the time. I need this daily. Want to make sure that's a part of the Ambetter formulary list. So you select your state on our website. Takes you to a For Members tab is where you want to click. Pharmacy resources. And then from there, you're going to see the preferred drug list. We have 2019 listed right now. Obviously, 2020 will be available. And again, these don't really change much from year to year. So if it's on the 2019, you can pretty much take it to the bank. That's going to be there for 2020. Going to get this huge PDF file. So nobody has all the time in the world to go through 189 pages. We're all doing multiple enrollments throughout the year. Helpful tip to using this, hit Control F, brings up a search bar. Just want to type in the medication. And if you don't see maybe a brand name right away, try the generic version or what maybe more the scientific name of the drug. Sometimes they're listed as that. And then a couple different tiers that we have for a prescription, starting at tier 0 and then going all the way down to tier 4. The higher the number for the tier, that's going to be the higher out-of-pocket cost some of these preferred drugs and maybe specialty drugs. For the most part, everything kind of falls in that 1, 2, and the 0, whether lowest copayment, medium copayment, stuff like that. And then a couple other helpful things here, the abbreviations. Kind of the two that I always call out are the prior authorization and the quantity limit. Some drugs, specialty drugs, need a prior authorization that the doctor just needs to call. Not that we won't do it, just that they need to call to pre-authorize before putting the prescription in. And then the quantity limit, some of these drugs maybe have 30, 60-day supplies, or maybe you take a couple daily. We're just going to kind of put that in there, what's a part of our formulary list. And just an example here, you see the drug tier, so kind of the different numbers. And then the requirements, maybe limits, whether we need a prior authorization or, again, kind of with that top one, the quantity limit. So, for this one, it's going to be 4 each daily. So we just kind of break it down to show what we cover, based on quantity and whether we need authorizations, and then also kind of to make it easier to figure out how much you might have to spend out of pocket. We have those drug tiers. And again, really want to thank you guys for joining today. I appreciate you giving me the opportunity to kind of tell you a little bit more about Ambetter. Micah, that's if we want to get into some questions. I know we went through a ton of information. This is all going to be available on our website as well over the next few weeks prior to open enrollment. We'll have plan grids, everything like that. Where we'll be able to kind of go. You can take a more detailed look at everything as well. I know we ran through so much information today, but I really appreciate the opportunity.
Thank you, Michael. Yes, absolutely. As you can see, guys, there's going to be a lot of opportunity this year on the under 65 health market. Very competitive price, great network, great support. So if you're looking for an alternative from what they currently have, or even if they're brand new to the market, this is a great choice for you. And we'll go over some of the questions here. The first one I see is they're asking if he's already appointed with Allwell, which is Centene. Is that a separate contract? So I'll let you go ahead and answer that one.
Yeah, so that's actually a great question. It is a separate contract. So we're all under that Centene family, but Allwell is our Medicare Advantage. Obviously, they have their own contract. On the Ambetter side, we have a separate contract as well. So, if you're already contracted with Allwell, we'd love to have you kind of under the Centene family for our side. I would just reach out to Micah and the guys over at Messer, and they can get your name over to me, and we can see about getting you an Ambetter link.
And just so we know, this is the Ambetter appointment is on SuranceBay. So for those of you that already have a profile built with Messer Financial on SuranceBay, it is going to be on there. You can go in there, request it today if you haven't done so already. Just know that whenever you request it in SuranceBay, there will be one additional link that's going to be sent to you that must be completed. So just keep an eye on it. Once you submit your appointments, request through SuranceBay, that there's going to be another link coming right behind it, and it is under Ambetter. So great question there. Are there time delays for the basic major dental coverage?
I do not believe so, but let me, Mike, if you give me an opportunity, I'll get with our product guys just to clarify. But I do not believe that there is a time delay on that. But I definitely want to talk with our product guys just to be sure without,
Sure.
saying definitively one way or the other.
Sure. Do you know if the $1,000 include preventative costs?
Yeah, so those are going to be subject to that. So like a lot of like the oral exams, stuff like that, are going to go towards that $1,000. A lot of that I believe has a $0 copay though. So from the member standpoint, they're not going to have to pay anything up front. It's just going to go towards that $1,000.
Okay, and who is the network for your dental?
The network, I'm not sure off the top hand. I'll get with the product guys just to see who our provider is in the Carolinas, who we work with like across the states.
Okay, great. Let's see. Does this coordinate with Health Sherpa, MyMFG? So no, Health Sherpa is its own entity. It does not. So MyMFG is something that we build inside of Messer Financial that works as the CRM and can do all the different carriers and also to collaborate with your Medicare Advantage book. So it keeps it all in one place, which makes it useful. But there is also another question on there that says, if we are already using Health Sherpa for Blue Cross Blue Shield, will we be able to see both companies and continue to enroll both from the same account?
So the Ambetter account is going to be, and again, you don't have to use this. It's just something that we offer. You would only be able to see Ambetter quotes in there. But, if it's something where you run a quote and maybe, the Blue Cross you've seen consistently in an area where maybe the Ambetter is a better option, you can actually export your information and then upload it into the Ambetter portal if you want to do that. Or, on Sherpa, like the main Sherpa, your personal, you're going to see quotes from both the carriers. So if you want to just use that, you can do that as well.
All right. And this one's about the network. So what about South Carolinians right outside of Charlotte, I'm guessing probably in the York area, who use either Atrium or Novant's providers in Charlotte?
Mm-hmm. Yeah, so, as a whole, with Ambetter, you can cross state lines and use an in-network provider. We do not have Atrium since we're not not in Charlotte as of yet. That's something that, I would think down the line we're going to have. I know some of the hospitals that, are in that Rock Hill area. I think Piedmont's really the big one that we called out. But yeah, Atrium is not going to be a part of the network. A lot of that has to do with our footprint isn't into Charlotte, so we weren't able to kind of get a deal with those guys, to do that for this year.
Another question was someone had mentioned that they thought they heard you say that the premium counts towards the MOOP. I don't believe that's the case, but just want to confirm with you.
No, it does not.
Let's see. What South and Central North Carolinas are you in? What Eastern, Western, and Central counties? And I think you've already shown it. Do you have that slide again? Can you show where you're going to be in North Carolina?
Yeah, let me give me 1 second here. I can go back to those slides. So I'll do North Carolina first. 1 second here, guys. So that's going to be our footprint in North Carolina. So the 14 counties, Alamance, Coswell, Chatham, Durham, Franklin, Granville, Guilford, Lee, Orange, Person, Rockingham, Vance, Wake, and Warren. And kind of the two differentiators on this slide here, the ones that are in that pinkish raspberry color, those are going to be new counties for this year. Last year we were just in Durham and Wake. And then for South Carolina.
Yeah.
Give me 1 second. So again, last year we were just in Charleston, and then that's going to be our county expansion this year. So really, Rock Hill area, some of those surrounding counties like Lancaster, York, obviously for Rock Hill, and then the three around Horry, so Horry, Marion, Florence, and then getting outside of Charleston, those counties there. Kind of the one gap I would say with the footprint, I think it's Georgetown County that kind of connects Horry to Charleston. There's going to be a little bit of a pocket there where we're not in. But around Charleston, we have the majority of the counties that kind of touch Charleston, getting out a little bit outside. Then obviously Myrtle Beach with Horry, Marion, and Florence, and then up in Rock Hill area. So that's going to be the list this year for our footprint.
So, Michael, that looks like it's all the questions that we have. I just want to make sure that everyone is aware, even though they're relatively new to us here in the Carolinas, Ambetter has a huge footprint in other states. They're just now reaching up into our areas. But Florida, Georgia, Texas, Chicago, Illinois area, I mean, they're really all over the place. And as Michael said, they're the largest for a reason. And they're not going anywhere, and they're only going to keep getting stronger, and their availability is only going to increase. So I think it's going to be a safe bet doing business with them, and I think that they're, like I said, going to be here for a long time. So also, just as a reminder, if you want to know about commissions, please contact your upline or contact us. We would be glad to discuss that with you. I definitely feel that it'll be worth your time to market them. And really, that's all that I have. Michael, did you want to close out with anything?
No, just again, really wanted to thank you guys for your time and for your questions. Some of those that I didn't have the information right in front of me, I'll definitely get some info over to Micah just to clarify with that the vision and dental stuff. But Micah, to your point, I really appreciate you mentioning that about Ambetter. I know in the Carolinas, you guys may have had some carriers maybe kind of dip their toes in for a year and then kind of back out of the ACA marketplace. We continue to grow every year. North and South Carolina were new states for us. We're in 18 different states. For the most part, our footprint in all those other states covers 75% or more of the county footprints. Some states we're in every single county. ACA is all we do at Ambetter. We have kind of the backing of Centene. We're a big driver for the Centene family. We're not going to go anywhere. So if you write your client with Ambetter this year, you can kind of be rest assured and sleep well at night knowing that, come 2021, Ambetter is not going anywhere. If anything, we're going to grow our footprint and continue to grow our network and everything throughout the state. So, we're going to be a viable option this year, especially when you start seeing some of the price quoting around OEP. I really appreciate you guys' time today, and we're really excited about what we can do in the Carolinas. And I know I've been talking up to Mike and the guys over at Messer constantly, for the past few months. But it should be a great year for us and very exciting, especially in these two states.
So thank you again, everyone. If you need to get appointed or haven't done so already, please contact us. You can reach us at the office here, 704-568-9649. It's also on our website, messerfinancial.com. Whatever we need to do to get you up and ready to sell, we'd be happy to help you out. So again, thank you, everyone, for your time today, and have a great Wednesday. Thank you, everyone. Bye-bye.